Hi, you guys, and welcome to the channel. My name is London. I am a labor and delivery nurse and have been for many years. I have assisted in over 100 deliveries and have helped women from lower economic status to higher economic status, women who have done C-sections, high birth deliveries, women who have gone unmedicated. So I have a realm of knowledge when it comes to labor and delivery, and also the postpartum phase and also the antepartum phase. And I am here to help you guys make informed decisions, and that is what this channel is for. It is to help educate you guys so that you feel empowered and inspired to make your own decisions when it comes to your healthcare, or partner with your healthcare professionals so that you guys can come up with a plan of care for you that best fits you. I am in no way giving any advice on this channel. I want you to really take the information, learn from the information, but really come up with a plan of care with your particular healthcare professional. So please understand that this channel is not giving any advice to anyone. It is simply my knowledge, what I have gained, and I am sharing that with you to hopefully educate you in some way so that you can make better decisions for yourself. So without further ado, today we are going to be talking about the first medication that is usually offered for an induction is a medication called misoprostol. We give this medication in very small doses. It's usually, you can give it in two ways, either vaginal or oral. Most people, most healthcare providers will give it oral. I've seen very few who give it vaginal just because of the effectiveness of it when you give it vaginal. But you know, most healthcare providers give it oral just because the studies show that when you have it oral, it's a little bit more effective. So misoprostol is a prostaglandin. It is a medication that is used to thin your cervix, and we're going to talk about what thinning your cervix means when we talk about cervical exams. So it is a medication that's used to thin your cervix. The next medication that may be offered at your particular hospital is a medication called Cervidil. Cervidil is another prostaglandin. This medication, it kind of looks like I don't know, like a small kite. It looks like paper, and it has a string at the end. And Cervidil is placed vaginally. That is the only way that it can actually be placed. It's placed vaginally, and it is used to help ripen the cervix. So misoprostol and Cervidil are prostaglandins. Most hospitals have moved more towards misoprostol and using misoprostol more. There are several different reasons why your healthcare provider may want to use Cervidil, but I am seeing that Cervidil is being less and less used in the hospitals today. So, but that still is an option in the event that your healthcare provider thought that it would be necessary. Instead of using misoprostol, they would use Cervidil. And misoprostol, let's go back to misoprostol. Like I said, it is a prostaglandin. You can get up to 6 pills of misoprostol usually in most hospitals. And it is given every 4 hours, as opposed to Cervidil, it stays in for about 12 hours. And unless your healthcare provider pulls it out before then, or unless you become more active. And that's with either of these medications. They're not going to be given to you if you're starting to become more active, or if your cervix is changing and you no longer need them. The next thing that is used to help with an induction is a cervical ripening balloon. Okay. This is a mechanical dilator, and most doctors say that it does both things. They say that it softens the cervix, and they also say that it mechanically dilates you. In my personal opinion, I feel like it mostly just mechanically dilates you as opposed to softens you, which is more of what misoprostol would do, or Cervidil, soften your cervix. Those are prostaglandins. The cervical ripening balloon really just mechanically dilates you. And that balloon can stay into up to 12 hours. And usually it falls out before 12 hours. And when it does fall out, you are anywhere between 3 and 4 centimeters, most likely. That can vary for different people. Usually, if it hasn't fallen out and I'm taking it out of my patient may just be 2 centimeters, barely 3 centimeters, or like 2.5 centimeters. But mostly when it falls out, if it was placed correctly, you should be at least 3 centimeters dilated. The next medication, and this medication has such a reputation. Every time my patients come in, they're like, I gotta get Pitocin. And Pitocin is pretty much the last line of medication that we use in an induction process. It is a medication. I say that it is the force. It is artificial oxytocin. So just a little backstory, we release oxytocin all on our own. And the artificial oxytocin helps in conjunction with our own oxytocin. So that is really what Pitocin does. It helps to make your contractions more regular, and it helps to make them stronger. There's various different levels of Pitocin. There's high dose Pitocin and there's low dose Pitocin. Usually we start off with a very low dose Pitocin to see how you and your baby are tolerating Pitocin. And it is a medication that is very titratable. So in the event you or your baby is not really tolerating the Pitocin, it is always able to be turned off. You can just ask for it to be turned off, especially if you're in a lot of pain and you're in the process of getting your epidural and you don't feel like you could sit still, things like that. You could ask for your Pitocin to be turned off until you get more comfortable. In the event that your baby's not tolerating the Pitocin, most likely 9 times out of 10, your healthcare providers, you will hear them saying, we turned off your Pitocin, we turned off your Pitocin. So that we can calm your uterus so that also the baby can recover if anything's going on with the baby. But it is a titratable drug. It is not something that we push. It is titratable. I usually say that Pitocin should be the last line of medication used, because sometimes what I see in inductions is some of my patients don't even need Pitocin. They do really well off of a couple misoprostals, or they do really well off of misoprostol and a cervical ripening balloon, and they usually may not even need Pitocin. There are some patients who need it all, and they still do very well. I just don't want you guys to go in and be scared of Pitocin, because I have seen all of the horror stories online about what people feel like Pitocin is responsible for. But there are various different reasons why some of these things could have happened. And the misconception sometimes I feel like is that Pitocin is the cause. But there's various different reasons, and I just want you to understand that Pitocin is a titratable drug. You can always ask your healthcare provider, if you are on Pitocin, to start off with low dose Pitocin. You can ask them for several different things within that. I don't want you to feel like just because you're on Pitocin, you can't ask for things. You definitely can, depending on your situation, depending on what's going on with you and your baby. You can come up with a plan with your healthcare provider and let them know kind of what you're thinking and what you're feeling in regards to Pitocin. So that is really the induction medications that are used to induce labor. That's when you don't come in with any type of labor. You're not really in any labor. Those are the medications that they may use to induce you. During the induction process, there's also one other thing that they may do to continue to push your labor in the right direction, or like another natural induction agent, if you want to say. And I really say natural in parentheses because it's not really natural. We're doing it to you in the hospital. We're doing something to you. So anytime we're doing something to you, it's not natural. But It's like a least invasive method is breaking your water, and we call it rupturing your water bag or breaking your water. That is also something that may happen later on down the line in your induction process if we kind of feel like you've stalled out or you're making good change or you just need a little push. Your healthcare provider may say, hey, let's break your water, give the baby a chance to come down, or give, all that. I think that's all you need is maybe your water to break. And that's going to help send some signals to your brain to help your uterus contract a little bit more. So that may be something that they say throughout your induction process or during your induction process is, hey, let's break your water. So if that is, don't be alarmed. We're also going to go over some things that I want you to pay attention to when you are asked that. So until next time, I will see you guys in my next video. And yeah, love you, wishing you the best, the most safe, and the most wonderful delivery. Understand that this is a journey and just enjoy the journey. Bye.